Thank you. Last year, nearly 200,000 women were diagnosed with breast cancer. 40,000 women died from the disease last year alone. Joining us with more, Dr. Vince Cataldo, medical oncologist with the Hematology Oncology Clinic at the Baton Rouge General's Pennington Cancer Center. Great to see you. Good morning.
Nice to see you. Nice to be here.
I think a lot of people in their 40s got completely confused by the guidelines that came out by one group. And should you get mammograms, should you not? Where do you stand?
The U.S. Preventive Services Task Force last year handed down some very controversial recommendations that de-emphasize the need for mammography in women in their 40s. Personally, I still believe that there are good reasons and good evidence to still perform screening mammography in women in their 40s. More importantly to recognize is that this is only one group that offered their recommendations, and there are other groups that still recognize that there is very good evidence, such as the American Cancer Society and the National Comprehensive Cancer Network, that still recognize that there's good data to support that, yes, early detection in women in their 40s do emphasize the need for mammography for those young women.
Some women may be confused now, too, like, well, will my healthcare provider, does my insurance cover mammograms? Has it changed that? And what would your advice to them be?
What's important is to have a very in-depth conversation with their clinician and discuss their findings with the clinician so that the clinician can give them more guidance as to whether or not a screening mammogram is necessary for them. And nothing will trump the decision-making that's made between a physician and a patient.
For people who haven't gotten, women who haven't gotten mammograms probably in the last 5 years, they've changed a lot, and for the better, right?
Absolutely. They are. They tend to be more comfortable, and actually there are better tests now available.
And is that because of the digital age?
As of now, we use screening, radiographic imaging, and digital is not completely always necessary, but that is certainly offered here in Baton Rouge area. There
have been impressive gains in the survival rates of breast cancer patients. Why is that?
Every year we recognize a true improvement in survival of women with breast cancer, and that probably is most contributed to by early detection, because earlier breast cancers that are discovered are easier treated and more effectively treated when they're found early.
How often should women do breast exams?
This is another controversial area, but I'm still a huge proponent for a woman to be very aware of her breast anatomy and to be very vigilant of changes in her breast anatomy. This should be done monthly and should be recognized. Changes should be recognized and be aggressively reported to their clinician.
What's the most exciting thing for you right now that's happening at the Pennington Cancer Center?
Newer agents that are available and that we are actively investigating, and what's important that we are so fortunate to have in the Baton Rouge area is to have the Pennington Cancer Center that is recognized by the National Accreditation Program for Breast Centers, which recognizes the fact that our Pennington Cancer Center has all the treatment, all of the components that are necessary for quick diagnosis, fast diagnosis, early diagnosis, excellent treatment by experts, and continuing education for us physicians to make us smarter and better doctors for our patients.
And that's what every patient wishes for.
Absolutely.
Dr. Vince Cataldo, thanks for joining us this morning.
Great to be here. Thank you.
Absolutely.